Hey folks, so we're back. My name is Rob, and we are here for part 4 of this exciting video series. And this is to talk about Part C, or what's known as a Medicare Advantage plan. And a lot of people, Medicare Advantage plans have gotten a lot of press over the last few years. They were something that was enacted several years ago, I believe under the Bush administration. Don't quote me on that, but they've been around for quite a while. And basically what a Part C or Medicare Advantage plan is, it's a plan all into itself. It's a health plan that is administered by private insurance companies. So let me say that again. You would get your coverage through private insurance companies. And here's the thing, folks. We already ran through parts A, and B of Medicare, and we talked about Medicare supplement plans. And I hate to say this, folks, but you almost have to forget everything you learned about parts A and B and Medicare supplements. In other words, the first 3 videos, you almost have to forget what you learned about Medicare. And again, I hate saying that, but a lot of the deductibles and co-insurances and premiums and that type of thing do not apply when you talk about Part C or what's called a Medicare Advantage plan. Now, let me stress this, folks, and I have to, by CMS guidelines, Centers for Medicare and Medicaid Services, you always have Medicare Part B. You don't lose it, okay? It's just that it's not primary anymore. These Part C plans become your primary payer. And in that sense, you have to play by their rules and their regulations and their copays. So, like I said, you always have Medicare. You're still going to have to pay that Part B premium. Unfortunately, that doesn't go away typically in most situations. You're going to have to pay that. But if you elect to go into a Part C Medicare Advantage plan, then typically, like I said, you play by their rules. And I have a sample of actually one of the plans here in Connecticut. And again, most of these plans are going to operate the same throughout all 50 states. Like I said, Medicare Advantage plans, they have to cover everything that original Medicare covers. So, you know, you're not losing anything by enrolling in one of these. It's just that your copays are going to be different than typical Medicare A and B, and if you were to purchase a Medicare supplement. In other words, these plans wrap parts A, B, and D typically into one plan. Most Medicare Advantage plans actually include drug coverage inside of their plan, which I'll talk about in a minute. But I want to give you just a kind of a quick overview. I'm actually going to read you some highlights of one of the plans here in Connecticut. And this particular plan happens to cost $29 a month. And let me talk about premiums real quick. Medicare Advantage plans are typically offered zero, in other words, zero premium. Or they can charge a smaller premium like $29. Some go up to $99 a month. Some go to $104 a month. Depending on your state, the premiums are going to vary for these plans. But like I said, most companies offer a zero premium option, a smaller type premium like a $29 or $30 or $40 premium, and then a little bit higher, maybe around $100 a month. And like I said, every state is going to vary on that. But again, here in Connecticut, this particular plan is $29 a month. That would be your premium. So a little bit different than the Medicare supplement plans, which are typically a lot more in cost. Also, what's kind of neat is these Part C Medicare Advantage plans have an annual maximum out-of-pocket costs, or out-of-pocket. So for this particular plan, the most that you could pay on this plan for copays would be $6,000. So it's kind of a way to protect yourself so that you don't get a $100,000 or $200,000 bill in copays. So the max would be $6,000. And let's get into, so your primary care physician or your doctor's office visit, that would run you on this particular plan $15 would be the copay for your PCP, your primary care physician. If you were to see a specialist, it would run you $40 per office visit. Preventive services, just like in original Medicare, would be a zero copay. If you went into the hospital, remember I talked about in Part A how the first day you step in the hospital, it's a $1,260 deductible. Well, here, inpatient hospital care is $395 a day, days 1 through 4. So if you were there for one day, you would only pay $395, which is a lot different than what you would have faced if you had Parts A and B of Medicare and you didn't have one of these plans. You would pay $1,260. So pretty big difference. But again, if you were there all 4 days, you would pay almost $1,600 on this plan. So if you do the math for a minute, folks, you could potentially pay more or less on one of these plans if you went into the hospital. So anyway, let's jump into skilled nursing. If you went from the hospital to skilled nursing, the first 20 days, just like in Medicare, you would have a zero copay, folks. But if you went days 21 through 59, you would have a copay of $155 per day that you were in the skilled nursing. And then if you were there days 60 to 100, it would drop back down to zero copay. So again, folks, you got to really pay attention to your copays on these plans. Outpatient surgery, if you went for outpatient services, surgery, that type of thing, it would be 20% of whatever the bill would be. So you'd pay 20% of the cost. That sounds familiar, right, folks? We talked about that in Part B. But again, outpatient surgery, it's 20%. Diabetes monitoring supplies would be a zero copay for covered brands. Home health care would be a zero copay. And again, there are limits on home health care on these plans. You'd actually have to look at your outline of coverage to look at those. Diagnostic radiology services such as MRIs, CT scans, that type of thing, 20% cost sharing, again, folks. Lab services, if you went for blood work, it'd be like a $13 copay. Outpatient x-ray services would be a $16 copay. Ambulance, you'd have a $300 copay. Emergency care, it doesn't matter what state you're in, by the way, folks, would be a $65 copay. Urgent care would be a $40 copay. Routine physicals are zero copay once a year. Vision, like routine eye exams, will be a $40 copay. Vision and eyewear, zero copay every 2 years, up to $70 for frames, standard lenses included, or $105 for contacts, up to 4 boxes. Dental, this particular plan has dental, zero copay for covered services, x-ray, cleaning, and exams. Foot care routine, $40 copay, limited to 6 visits per year. Hearing routine exam would be a $15 copay once per year. And then they also have a hearing aid benefit, so $330 to $380 copay, depending on what brand you get, that type of thing. And then, as I mentioned, this also has some Part D, or it has Part D prescription drug coverage. And typically all these plans, there's 5 tiers. Typically that's throughout the U.S. It doesn't matter if you're in Connecticut or California. Most of these have 5 tiers. And preferred generic drugs, you would pay a $2 copay for a 30-day supply. Tier 2, non-preferred generic drugs, you'd pay a $9 copay. Tier 3, preferred brand drugs, you'd pay a $45 copay. And again, that's for a 30-day supply. Tier 4, non-preferred brand drugs, you'd pay $95 copay. And then Tier 5, specialty tier drugs, you'd pay 33% of that cost. And again, a lot of these plans are also subject to something called the donut hole, which I won't get into too much. I will tell you, though, that coverage gap, basically what it is, and I'll read it verbatim here. After your total drug costs reach $2,960, you will pay no more than 65% of the total cost for generic drugs, or 45% of the total cost for brand name drugs for any drug tier during the coverage gap. In other words, once you and the company, copay-wise, have spent $2,960, you fall into what's called the donut hole. And I can get more into it during the Part D coverage, folks, but I don't want to make this video too long. And then it says catastrophic coverage states, once you, after your total out-of-pocket costs have reached $4,700, you will pay the greater of $2.65 copay for generics, including brand drugs treated as generic, or $6.60 copay for all of the drugs, or 5% of that cost. So bottom line, folks, is that the name of the game is for the Part D coverage. You want to try to stay out of the donut hole or that coverage gap. You can do that by getting generics. I mean, obviously, if brand name is the only thing that works for you, you want to go brand name. But if you can, generics are the way to go. And again, I can talk more about it in the Part D portion of the video. Just know that there is that coverage gap, and you'll have to talk with your agent more about it because it is a little confusing. But anyway, let's wrap up with Part C, what these programs are all about. Basically, private offered through private health insurance companies. You know, you're going to have copays versus coinsurance and deductibles typically. That's how they work. So if you had health coverage during your working years, you probably are familiar with these type of plans. During your working years, you probably had copays. These plans are very similar, and just like your working years, typically they're all networked. In other words, they're HMOs, which stands for Health Maintenance Organizations, or PPOs, which stands for Preferred Provider Organizations. You have to make sure that your doctor and your hospital are in your network with these plans, which typically in most states, especially here in Connecticut, most companies have the doctors, the specialists, and the hospitals in these networks, so it's not as much of a concern as it was years ago. HMOs used to get a kind of a bad rap. Nowadays, they're kind of the preferred way to go. So anyway, with that said, you want to check with your agent, make sure that your doctors, your hospitals are in there, you're comfortable with those copays. These plans are great for people that typically don't see the doctors a lot. I mean, if you're receiving ongoing care every week, if you're in physical therapy, or you're somebody that's chronically ill, these may not be the best plans for you, because when you add up all the copays that you pay every week or every month, it might be cheaper just to purchase a Medicare supplement plan. But we have no way of knowing that unless you meet with a qualified agent or you talk to somebody to compare and contrast which plan might be better for you. So again, I'm trying to keep these videos brief so that you can get just a broad overview of how these plans work. So as always, give me a call. Or like I said, you can look to the right. I should have a quote box there. You can compare. I can send you a comparison of these plans so that you can see. As I mentioned, there's about 5 or 6 carriers that offer these plans here in Connecticut, and it varies. Some states have over 40 carriers that offer these plans. So here in Connecticut, we have about 6. And you can, compare and contrast. Some of them have different premiums they charge each month. Copays are going to be different, but by and large, a Medicare Advantage plan might be right for you if you're somebody that, like I said, doesn't utilize services a lot. Again, nobody has a crystal ball. You never know what might be right for you or wrong for you, and that's why these plans, you can switch them year to year during your open enrollment, or what's called your annual enrollment period. Maybe you find that from year to year your health changes. This may not be the best plan. You may want to move to a med supp plan. So anyway, that's it in a nutshell, folks. Hopefully you got a lot out of this, and we'll see you in the next video.